Hey everybody, it's good to see you guys via video. This is Dr. Royer. You've had an opportunity to work with John Wieringo on all your assessments. Most of you should have one of these, which has your precision, power, focus, all your results. We're really excited to have all this data, and thanks for taking the time to participate in it. And what we want to do next is, now that we have some numbers from your assessment, we want to move forward with really trying to push you into doing some of the work in the Inner Armor program and doing the training, not just assess it, but doing the training. So I have a special guest and a good friend with me today, Dr. Ryan Bentley. Can you kind of introduce yourself to the medical students and kind of give a little of your background?
Yeah, so I'm a little bit of a different hybrid here. Started off my career going into medicine and then had a back injury playing football in college, and ultimately ended up going into chiropractic first, only to find myself 8 years later going back to school, and at the ripe age of 36 and went back to
Wow.
medical school and did my MD and PhD. So I do have 3 doctorates, but really it's not about it's going through all that was really to how can I help people better. Now I have a pretty integrative practice where we see everything from professional athletes to newborn babies, all the way to people with stage 4 cancers, to people that are wanting to stay healthy and well and have years of good health span.
We introduced the Inner Armor program to you about a year ago. Can you tell us a little bit about what your experience has been with the Inner Armor program and why Inner Armor might be important to you?
Yeah, so interesting because, I always think about the body on a physical, chemical, emotional level. And how does the body regulate? And the fear-driven process of our body and our thoughts and emotions and how it all connects. When I met you, it was like, oh my gosh, this is like the missing piece. Like, really good from my chiropractic aspect and sports medicine, really understanding the musculoskeletal type aspect of it, but also how does that translate from biochemical imbalances, whether it's hemochromatosis or rheumatoid arthritis and all these different things. And then the chemical aspect, but it was the brain that I was like, how do we, it's not just, people aren't depressed because they have a Zoloft deficiency. Can these medications be helpful in a pinch? Yes, but long term, how do you handle the PTSD? How do you handle those stressors that get wired? And just like if someone physically picks up a baseball bat and swings it for 10,000 hours, they're going to have this muscle memory in their body. And I think about the neurological pathways. When someone's chronically stressed, you start rewiring your body, and you rewire these processes. And so when I was approached and to meet you, and then had the ability to look at Inner Armor, I mean, it was like, to me, it was like, oh my gosh, finally, it's like the missing link for me.
Yeah.
And so now I'm able to help my body and also help patients on a physical, chemical, emotional level and how to regulate that. So when I look at Inner Armor and what it is to me, it gives me, we have this internal regulating system, our autonomic nervous system, our fight or flight or parasympathetic rest and digest type system. But if you are constantly in this state of stress, your body is chronically grinding, right?
Yeah.
And you don't get that relaxation. So you're eating on the run, you're driving to work and going into the hospital and eating on the way. And then you might be able to get a break in the middle of the day after you're doing rounds and all these different things. So you're constantly in this fight or flight response. Oh, we have a code over here. And then so you go run down there. And so your body never gets that relaxation. And so med school, residency, it's all hard. It's stressful. It's assimilating vast amounts of knowledge. It's taking that knowledge and translating that into patient care. And then it's taking time away from your loved ones and your social reprieve that we get of being able to relax and care for ourselves. You might get a break in 17 days, where you've been on, working 80 hours a week and those types of things. So how do you regulate that? And that's what Inner Armor has done for me, is be able to help train my body in a way that I can stay focused and calm in acute emergent situations instead of honestly just freaking out. Oftentimes I'll see med students, I still work with med students and teach at Western Michigan School of Medicine. And so they come to my office and I work with them. And a lot of times when they're doing rounds in a hospital, they'll get asked a question in front of everybody. And all of a sudden it's the deer in headlights look. It's a lot. And as you're taking a patient history, how do you keep your brain calm and be able to listen, assimilate that knowledge, translate that into your physical exam findings and create a good, effective, personalized and predictive protocol for the patient to heal. And you can't do that if your brain is in this constant state of stress. You have to be in this relaxed state in order to have clarity of mind. Because if you're getting chased by a bear, immediately you become very hyper-focused and you're only focusing on one little thing and you can't think clearly on everything else. But again, you have to, because again, our body is connected. You know, the physical, chemical, emotional, and you think about all these pathways, you can't just focus in on one thing and just narrow in. Now, okay, someone's coding, you're going to do CPR. That's the only real thing that you're focusing on. But at the same time, you know, okay, let's push epinephrine, or, you know, what did we do? Do we add amiodarone? Do we need to, you know, do we need to do cardioversion? What are we doing here? And you have to stay calm in those situations when you're running a code. And so that's where you typically have the most calm person that's walking in that is going to be, okay, you're going to do this, you're going to take care of this, and they are just making sure all the people, because again, it's teamwork. You can't do it as an individual. My office, I am blessed with an amazing team, but at the same time, I have to be a leader and be able to recognize when they're in a position they're not comfortable with. How do we back that off, put them into a position for them to succeed, and for them to feel comfortable as we get to help and serve people on a daily basis. So the inner armor in doing this, you have to make it part of your routine. Because again, your routine is stressful. It is all stress. And if you don't break that habit and take time to control it, I mean, 8 minutes a day is what it takes really to run through this and graduate as you go. And it's interesting because, and you have to fiddle with it a little bit because you have to learn your body. If I'm slouching and I'm just not paying attention, I'm not focused, I'm not really training anything. It's like going in there and, all right, well, whether I'm shooting 3-pointers or I'm trying to master swinging a baseball bat, if I just kind of go in there haphazardly, you got to go in there sharp and ready to learn from my body. And this gives me that biofeedback with the precision, power, and focus. It gives me that biofeedback so I can learn to regulate my body and know what it feels like when my body's starting to get out of rhythm, because I want to maintain that balance. You know, if you guys don't do this early and create these habits, it's going to create a burnout, and then you're going to be feeling miserable. And, you know, I'm going to be real. I was in residency, I was chief resident, and with 6 months left, I wanted to quit. So they gave me the option, like, don't, I was like, has anybody ever quit with 6 months left? They said, honestly, yes, we've had one person. That was tough. And it really took self-reflection. But if I was in this constant fight or flight response, which was starting to get there, I was at my threshold. And that's the reality. As med students, as residents, as physicians, as people, we all have this threshold of stress that we can handle. And it's, you add on there, let's say you have all these emotional stressors going on. Well, now your threshold, your delta is right here. And now you add in biochemical imbalances because you're eating trash every day. You're not fueling your body with the vitamins, minerals, proteins, fats, carbohydrates, and water, and breathing properly to get the oxygenation into your cells for your body to thrive. So now your threshold's here. And then all of a sudden, now you throw in there back pain or sciatica. And now it doesn't take anything to push you over that edge where you might just fly off the handle or say something in a way that is not of your character. And so it's all about how do we reduce that threshold from, you know, being here to removing that physical stress, removing that emotional stress, removing that biochemical stressors, and giving you more of this delta so you can handle the changes and the swings throughout the day. And that's ultimately what Inner Armor does from the precision, power, and focus, is it gives you that ability to withstand. It gives you better resiliency. And not just resiliency, also the robustness, which means how hard can you keep getting hit and keep going, you know? And I think that's actually in a Rocky song or a Rocky movie. You know, how hard can you get hit and get up and get back up and keep going? And that's your robustness, you know, that it doesn't hit you. Your resilience is your body's ability to rebound and get back to that. And so it's only helping your body to be able to, because we're all going to have stressors. So your level is going to go like this throughout your day. But then your resiliency is going to help you bring it back down here. And that's what this does. It helps you control that to bring you down to this baseline. So again, you can handle that swing the next day. Because if you're not recovering, you're going to stay throttled right here. You're going to lose sleep. If you don't get sleep, you don't have your lymphatics working in your brain. Then you can't get into your REM sleep and your deep sleep. And then that just messes your next day. And it just keeps going. On a daily basis, Tim, I use this.
That's awesome.
And I am grateful because I would feel these things. Like I said, I was on the verge of burnout at, you know, 6 months left of residency serving as chief resident and leading the residents, handling the med students, working the hospital floor, working with the administrators, working at the higher level of the med school itself.
Yeah.
But now when I had those feelings coming up, this has made me more self-aware because, again, you got that biofeedback.
Yeah.
So, guys, I can't tell you enough that this is important. It will help you, and it'll help you continue to create the life that you've envisioned. But again, you can't do that if you're in a state of fight or flight. You have to be able to control yourself and auto-regulate yourself, and that's what this helps you do.